I know I keep something in here. Oh yes, no kid. Come on. Oh no. Whether you're hiking, camping, or in an austere environment, having proper medical supplies on you is a necessity. Welcome back to Mission Ready Society. I'm your host, Orrin Price, and in today's video, we're going to be discussing what to do when you don't have the proper supplies. Now, it is very important and imperative that you do have the proper, medical supplies, but what do you do when you're in a situation or you find yourself in certain circumstances when you don't have, a proper device or proper medical equipment? Now, there are some, quick things that I need to note or should note about this topic is, this should be used as a last resort. Obviously, you're going to want to use proper devices and techniques. That should be kind of basic knowledge. So what I'm showing in this video today should be used as a last resort or in an extreme case scenario. I am no medical professional by any means, but I do have knowledge from my military background on these different areas and medical interventions. So without further ado, let's get into it. Now, the first thing we're going to talk about today is tourniquets. Tourniquets are a very essential piece of equipment that everybody should carry on them at all times. I will insert an image of what a commercial tourniquet looks like. I don't have one on me right now, or else I would show you in person. Shame on me. But on your kit, whether you're camping, you're hiking, out in the field, in an austere environment, whatever, you should always have a tourniquet on you. That's kind of like it's like a golden rule that you have a tourniquet on you, and kind of just standard. And tourniquets are used for mass hemorrhaging, and what mass hemorrhaging is basically just severe bleeding. So think of like large cuts. Somebody gets a limb, taken off. Somebody gets shot, whatever. Anything where there's massive amounts of bleeding to a limb. The reason I say a limb is because tourniquets can only be used on limbs. You can't use a tourniquet like on your torso or on somebody's neck, obviously, because you would strangle them to death. So injuries where there's mass bleeding to limbs is when you want to use a tourniquet. So now, what do you do when you don't have a commercial grade tourniquet? And let's say you find yourself in a situation where you yourself are experiencing some sort of severe bleeding, or somebody you're with is experiencing some sort of severe bleeding. I'm going to show two techniques on how you can make an improvised tourniquet. And the first is going to require 3 items here. You're going to want some sort of cloth that you don't mind cutting up, and you're going to want a stick about, 7 to 8 inches long here. And you want it to be nice and sturdy so it won't break. And you don't want it too big either. So the first step in creating this improvised tourniquet is you're going to take your piece of cloth. Now, this is just a old dish rag that I don't care about. That was going to go in the garbage anyways. So what you're going to want to do is cut it into about 2-inch wide strips. The reason I say strips is because this is too short to create one big long strip. So I'm probably going to have to tie 2 pieces together, possibly 3. But we'll see. That's not necessarily ideal. What you want to do is find a piece of fabric that is going to be able to be just one big long strand. I've literally done this technique with like scrap pieces of clothing that I found out in the woods. So any sort of fabric that like is sturdy enough to where it can, withhold a little bit of force and whatnot. So I'm going to cut this into about 2-inch strips, and then I'll get back. All right, so I ended up getting a different piece of fabric because that dish towel ended up being terrible, and it was too short. So this is the piece of fabric we're working with here. This is one big long piece. It is shedding, however, might make a mess. I also use a pair of scissors. It's a lot easier to cut it. So if you have a pair of scissors on you, I suggest using those instead of a knife. You'll get cleaner cuts as well doing that. So here's our piece of fabric. We're then gonna take our stick, right? This is gonna act as our windlass, which is basically just the handle of the tourniquet. So this is gonna act as our handle, and this is gonna be the piece that we turn to create that tension. So to create this improvised tourniquet, what you're gonna do is you're gonna take a piece of fabric, you're gonna create a bite in it like this, right? You're gonna want one side that's a lot longer than the other though. And then you're gonna create a little loop like so. We're basically just gonna make like a little, we're gonna make like a little hitch on this. So you're gonna take everything else, your two ends here, and you're gonna put it through that loop that you've created. And what this is gonna do is this is gonna secure our fabric to our stick here, just like so. Tighten it up a little bit, make it a little nice and neat, like so. And there's our fabric now attached. As you can see, this end is a lot shorter than this end, and you'll see why we made this side a lot longer here in a moment. And now I'm going to demonstrate on my leg how to use this. So I'm going to switch over so you can see my leg a little better. All right, now so basically you're going to take this, you would put it as high as you possibly can, but for this demonstration I'm going to put it a little bit lower. You want your windlass here, your stick, readily available. You don't want to put it on the inside because it's going to be harder to turn. And now basically all you're going to do is you're going to create a square knot with your two pieces on the limb. So I'll do that real quick. You're going to make sure it's nice and tight. Like so. This fabric is ripping a little bit. All right, now we have this, we have our square knot, we have this end here. Now basically what you're gonna do at this point, I'm gonna reposition this just a little bit. Since this is improvised tourniquet, it's gonna hurt a little more than a commercial one. So when you do this, you're gonna wanna lift up and twist. Though you can try and avoid getting the person's skin like I'm doing right now to myself. So lift up and twist, lift up and twist. And you would go a lot tighter than this because I can still get my finger underneath here, right? But you would go until the bleeding stops. That's the rule of thumb. But now, basically, once you have your windlass here, nice and tight to where the bleeding is stopped, you're gonna tie it off. So you're just gonna create a knot around this thing to stop it from twisting. And it's not gonna be perfect. You're kind of gonna have to, figure out where the best spot is to tie it off. But for this, I'll go here, and it might loosen up a little bit, but it's kind of not much you can do about it just because it is an improvised tourniquet. But there we go. Now it's secure so it doesn't come unwound. And now, obviously, again, you'd go tighter than this, but hopefully the bleeding has stopped, and it's a little hard for me to walk at the moment. And yeah, that is the first way in which you can make an improvised tourniquet. Obviously, this is pretty slow, especially if you have to go and cut a piece of fabric and do all that. So the next technique I'm going to show is a little bit quicker. However, it doesn't necessarily cut off the circulation as well. So let's jump over to that. All right, so the next technique is going to be with just a belt. This is a rigger's belt. You can do it with a standard belt, but not all the time. The holes go down the whole thing, and it might end up being, it might be too short and won't work. So what you're gonna do for this one is basically you're just gonna take the belt, you're gonna wrap it around the individual's limb, and you're just gonna pull the thing as tight as you possibly can. And the reason I say that this might not work as well is because it's a little hard to get it tighter because you don't have your windlass here to tighten it. So you really just got to get it like as hard as you can. You really got to reef on the thing. And it's a lot harder to do this on yourself because it's, hard to pull on it on your own. So that's another thing, but basically you're going to tighten it and you do your thing. And this one you can actually go through like so. And you would just tighten the thing down here. Again, this isn't really a good technique. It can work in a dire situation. But this belt the Velcro doesn't even doesn't go all the way around. So it really depends on the type of belt you have. If you have one of the friction style belts, yeah, this doesn't even work properly because of the Velcro. But if you have one of those friction belts where it bites down, it clips, that can work just because it relies on tension instead of Velcro or one of those little prong things with the holes like other belts. But you kind of get the idea. Again, you just put it around the limb and you just cinch the thing down as hard as you possibly can. It's a lot easier in another person because you can literally sit there and you can it would hurt, but you can step on them and literally reef on the thing. But yeah, those are 2 improvised tourniquet techniques. And if you find yourself in a situation where you do need to make an improvised tourniquet, hopefully one of these techniques will work and stop the bleeding. The fabric technique works better, I would say, in cutting the circulation off, just because you can get it a lot tighter. But again, granted, it takes a lot more time to make. And then you have the belt technique, which is a lot quicker, but doesn't cut the circulation off as well. And quicker because, oftentimes somebody will usually have a belt on them, and you just take the belt off and cinch the thing down. So so those are the 2 improvised tourniquet techniques that I'm showing in this video. So the next thing we're going to talk about is chest seal. All right, so now we're talking about chest seal. So what is chest seal and what is chest seal used for? Commercial grade chest seal is usually this plasticky sheet with a very sticky adhesive to the back. And it comes in usually 2 forms. There's vented and unvented types of chest seal. And the main purpose for chest seal is to cover up in a sucking chest wound, which is essentially when somebody's chest cavity has been punctured. Therefore, the pressure is not normal in the chest cavity, and it makes it hard for them to breathe. That's why it's called a sucking chest wound, because there's literally air coming in and out of the person's chest. And so basically what happens is there's an open wound and air is escaping, right? So what we do is we take the chest seal and you cover that wound, that opening with the chest seal, to then restore that pressure and allow them to breathe somewhat more normally. Well, sometimes, you have to do what's called needle decompression to drain fluids, but that's a little bit more advanced, and we won't be getting into that today. So let's focus on what to do when you don't have a proper commercial grade chest seal. And there's kind of one main method, and that's a plastic bag of some sort. This is just a standard, kitchen sandwich snack bag, and then a tape. This is just like duct tape, you can use packing tape. And the idea is this plastic bag is going to act as a barrier, so it would go over the wound. So if the wound is here, you cover it, and it acts as a way to seal it off, essentially. So that's going to be your cover, and then the tape is essentially your way of holding it to the person. So you tape down all the corners. And that's kind of like the improvised technique. is to, use this to cover it and then use the tape to seal all the corners off. So I'm gonna use my leg as like a way to demonstrate it. But obviously you do this on a person's chest. And another note too to think about is usually when somebody has a sucking chest wound, not all the time, but sometimes there will be a entry and an exit wound, meaning that on both sides of them there will be an opening, so you would have to use two. So normally, like when you get chest seal, it comes in a pack of two. That way you have one for the front and one for the back. So now let's get into the demonstration. All right, so now for this demonstration, I'm just gonna use my leg here, like so. It's not gonna be perfect, but essentially you're gonna take your plastic bag here. Since this is a sandwich bag or a snack bag, and I'm gonna fold it over, I'll make it a little bit smaller just because it is my leg here. Yeah, so you go like so. Like if the wound is here, we'll say, you're just gonna slap it right over top, like so, and we'll go this way. And then essentially you're just going to take a piece of tape here. I'm gonna get it. You kind of give yourself like a rough estimate. You wanna go, it's okay to go too long, rather be long than short here. And then essentially you're going to tape onto the person's skin and onto the bag. So you kind of want it like 50-50. So you go like so, and go like this. And then you're just gonna tear it like so, and there's one side. And then you go down the other side here, kind of measuring. You can also tear it before you choose, like so. Make sure it's really stuck down, because the whole idea here is that you don't want any air to escape, for there to be any openings. So just finish taping off these sides here. There's 3. And then the last side. Now, it might require more than one layer of tape, depending on how well you're able to seal it, but there's kind of the general idea. So now this would be covering that wound and would hopefully restore the person's ability to breathe properly and restore that pressure. And yeah. That's pretty much it. There's not much else to creating an improvised chest seal. And then obviously it just comes off like so, like this. And this is what you're left with. So like that, and yeah, just slap it on. Boom. That's how you make a improvised chest seal. All right, so the next thing we're gonna talk about is splint. And, a splint is used for stabilizing broken bones, whether that be a broken leg, a broken arm. And there's kind of 2 ways to do it. The first one I'm going to show you here uses some tape, or you could also use like some sort of cordage, like 550 cord, a piece of cardboard, and then probably going to need some sort of cutting tool. And then the second way in which I'll demonstrate would be to use some sort of long straight object, whether it be like a stick. That's probably the most readily available thing. You could also use trekking poles, something along that kind of nature. But yeah, the first one I'm going to show here is using a piece of cardboard. So the way that we're going to do this is I'll say that a broken forearm here, and now I'm just going to kind of roughly measure this like, let's say like here. I'm just going to cut this piece of cardboard to roughly the length of my forearm. And now if this is a leg, you'd cut it to the length of the leg. And now essentially what we're going to do is we're going to create kind of like a sled. So I'm going to take like the edges of it. So it's not going to be perfect, but that is okay. I'm just gonna fold them up like this to create kind of a sled. You might wanna make it a little bit smaller here. You're kind of just gonna conform it to, you know, whoever's limb you're putting this on. Kind of like so. Yeah, so like that. So now it's kind of conformed to my forearm here, like that. And now I'm gonna use tape. Well, like I said, you could use 550 cord or something else similar. And I'm just gonna put 2 strips on this for now. If you have to, you could just wrap this entire thing to make it nice and secure. But just because I'm getting low on tape here. Now, I go like so. Go like boom. I'll need scissors probably because. Okay. Whoops. All right. There's one piece. And then we'll put another piece on here as well. Just like that. Boom. And now, obviously this isn't perfect because I'm doing it on myself here, but that's kind of the idea. So now the whole idea behind this is that it will help keep that person's limb and their bone straight so it doesn't, you know, fold or flex or anything, which could cause more pain, and it helps to stabilize that. So now they can hopefully be transported without causing any further damage. And you can do this, you know, through a leg or an arm, obviously. And you could also, the nice thing about cardboard is if you need to, for whatever reason, if you need to create it at like an angle, right? Like, so if you're slinging somebody and you want to support like their arm like this, you could put slits in this to, you know, bend it so then it can conform to their arm, that kind of L shape there. But yeah, this is just one way to create a modified or improvised splint. So the next one I'm going to show you involves using a straight object. All right, so now we're going to talk about the straight object method here. And unfortunately, I don't have like a stick readily available, so I'm just going to use cardboard and act as if this was like a stick per se. The downside of using this method is if you do need to create that L shape, it's a lot harder. But for, you know, extremities where you just can keep it straight, this works good as well. So also get low on tape, so I'm just going to reuse the tape here. But the idea is that you'd put one straight object on one side of the limb and you put the other on the other side, kind of creating a sandwich like so. And then you're going to wrap it with tape or your 550 cord. So let's see how well I can do this on my own here. Tape here. Let me put it on one side. I'm gonna kind of just wrap it around here, like so. You do your other side. Just the same thing like we did with the other cardboard splint, but just with 2 objects on each side of the limb now. So you're gonna have something that looks like this. And now this will help keep the limb straight as well from bending side to side and forward and backwards. Obviously, you'd probably want to put a lot more tape or cordage around this just to secure it even more. But this is kind of the general idea of how to splint a limb using either cardboard to create a little sled type deal or 2 straight objects that you can put on either side of the limb to help keep it from moving around and causing further damage. All right, so then on this next one here, kind of building off of the splint, is going to be talking about how to make an improvised sling. And now this is pretty straightforward and actually really simple and quick. All you're going to need is a regular t-shirt. So if you have a spare t-shirt, works great. And literally all you're gonna do is you would just take the head hole, put it over your head like you normally would, right? Now, depending on whatever arm is injured, whether it be your right or your left, what you're gonna do is you're literally just gonna take that arm and you're gonna stick it through the opposite armhole. So if it was your right arm or somebody's right arm, you'd stick it to the left armhole, and boom, there is a sling to help keep their arm stable, like so. And like I said, if it's the left arm, you're just gonna take the arm and stick it through the right armhole, like so. And now you have a sling to help support that arm. It's pretty straightforward, really simple, but can also, be really helpful if somebody needs support with their arm because they've injured it. All right, so now the last thing that I'm gonna kind of talk about here today is just a pressure bandage or some sort of bandage. And really this is pretty straightforward. You're just gonna need some sort of cloth. You can use a t-shirt. This is a towel, really anything that's going to be absorbent. And the reason is because if somebody has a decent amount of bleeding, not to like where the point where it would necessarily need a tourniquet, but if they're bleeding pretty good and you need to cover that to help stop that bleeding, and soak it up and prevent from dirt getting in it and causing infection, then you're going to need some sort of bandage of some type. So for this, I'm literally just going to use a little hand towel here. And all you're going to do is you just take it. And what I would do is take it and fold it. And then I probably fold it again. I guess you don't necessarily need to. Maybe I won't. But what I would do is then roll this up. Like so. There you create this kind of like compact roll type deal like that. You do this with a t-shirt, like I said, as well, or some sort of other form of cloth. And then what you do is you're just gonna stick that over the wound. And now I would take 550 cord or a t-shirt and I tie it over top of this. And that would help secure it. You could also use tape again to secure it, but I would tie something over it just because it's more secure that way. And now what that's gonna do is it's gonna put pressure on this, right? To help stop that bleeding. And it'll also absorb the blood that is there. So now it's covered also, and it'll keep dirt from getting in there and causing infection. And just a handy thing to have if somebody cuts themselves or falls and trips or whatever. However, they end up in that sort of situation. And you can use this on any sort of limb. Like you can put it on the leg, thigh, calf, forearm, upper arm, like bicep, tricep area, anything like that. So yeah, that's gonna do it for today for improvised medical devices. Thank you for watching this video. This is kind of just some basic improvised medical devices and techniques that you can do. There's other ones out there, but they're a little more, technical and a little more complicated. So I just wanted to touch on some basic stuff today. Now, there is other ways that you can go about doing these as well. Like you could use, other materials. Like you could, instead of a Ziploc bag for a chest shield, you could use a plastic baggie, or you could even use a card. Basically anything that's not going to allow air to pass through it. So like you wouldn't want to use cloth or anything. But yeah, so again, I'm not a medical professional. I just have a little bit of knowledge due to my background. So that's kind of why I'm touching on the basics here. And I didn't go like super in depth with anything. I kind of just wanted to demonstrate how you would use these improvised techniques and some materials that you can use to do that. Now, if you do want to see something maybe a little bit more in depth about improvised medical and stuff like that, then please feel free to let me know in the comments. I'd be more than happy to make a video about that. But yeah, other than that, I hope you guys enjoyed watching this, and I hope you learned something. As usual, just like all my videos, I hope I'm sharing some knowledge that hopefully somebody will find helpful or find interesting. So yeah, if you enjoyed this video, consider liking and maybe subscribe if you're new here. I would appreciate it. But yeah, with that being said, I'll see you in the next one.